Hi, I'm Dr. Greg Pett, physical therapist, and today I want to talk about how to fix your golf swing if you're having any back pain. So, the biggest thing that we see with golfers a lot of times is they start getting pain in the lower back. So, really quickly, what I want to kind of talk about first is just the overall golf swing. So, the thing with golf, it's a very rotational sport, meaning that you're going through a massive amount of rotation on the backswing and then all the way forward on the follow through as well. So, the best way to describe what's going on with the lower back is that's the area that's having the pain, but that's not always the area that necessarily has the problem. Sometimes that's where you're getting the pain because that's the area that's trying to work too much for other areas that aren't necessarily moving or doing their job. So, what you want to do is you actually want to try to work above and below the low back, those joints, to get them to move to take the stress off of the lower back. So what I mean by that is you have your lower back, your lumbar vertebrae. Above that, you have your thoracic spine. The thoracic spine is where we get the majority of our rotation from. The lumbar spine, the way the vertebrae are built, there's not much rotation that comes out of that. So if we have stiffness throughout our thoracic spine, we're going to try to compensate and try to get rotation through our lumbar spine, and our back's not going to like that. You're still going to start to have back pain. Same thing below that, lumbar spine, then you kind of get into the hips. The hips have a lot of rotation as well too. If your hips don't have good rotational mobility, same kind of thing. The back is going to try to pick up the slack and increase some rotation through there. And the lumbar vertebrae, they're not designed to rotate. They're at the bottom of the back. They're big, they're strong, they're rigid. They're supposed to hold the entire weight of the spine. They're not supposed to have all this kind of rotation. So if you're not rotating through the thoracic spine, you're not rotating through the hips, your body wants to accomplish the task. So what happens is your lumbar spine starts to pick up that slack, but then that starts to cause pain in the lower back. So hope that makes sense. What I want to kind of talk to you about now is a couple exercises you can do before you leave your house for the course, and then a couple you can do right at the course before you're kind of on that first tee. So what I really would like people to do is kind of laying down on the back. First exercise, I call it a windshield wiper. So your feet are nice and wide. You can do this on the floor, your bed, anywhere. You're going to try to rotate one leg in, come out, rotate the other leg in. So you're getting some external rotation of one hip, internal rotation of the other. So this hip is internally rotating, while this one externally rotates, and now this one's externally rotating, while this one internally rotates. So just kind of going back and forth, kind of doing 15 on each side. So that'll get the hips to loosen up. And then to help kind of loosen up the thoracic spine, what I like to have people do, I call it an open book. So you're on your side now, knees together, knees stay together, hands together, and then you're going to rotate your top arm up, and you're going to watch your hand with your head, open all the way up, and then come down. Same thing, 15 times on each side, just like this, and then you lay on your other side, and rotate, and try to open up. Now you're getting that mobility through that thoracic spine. So again, if the thoracic spine has a lot of mobility and the hips have a lot of mobility, you're going to be able to rotate more in your backswing and your follow through, which is going to increase club head speed, which you all know increases distance. If you're watching the PGA Tour players and you see these skinny 150-pound golfers that can drive the ball 350 yards, if you look at how much they can rotate, they can get so much club head speed because they can rotate and move their body so quick through that rotation. As we get older, we lose the rotation through our spine and our hips, and that's why the club head speed slows down and we start to lose distance as we age. So those are good ones to do before you leave. And then when you're at the course, what I like to do is, well, there's two of them. I like to, if you're leaning on, let me grab something here. Just kind of the edge of the front of the golf cart or on a golf club even. And what you're going to do is you're just going to try to rotate. It's almost that open book, but now you're going to do it standing. You're going to try to rotate, try to get as much mobility as you can. Trying to do 15 on each side. Again, you can just lean on a golf club. So that's a good one to do. And then just sitting in the golf cart to try to get some mobility in the hips. Just trying to cross one ankle over, sit up tall, kind of lean down. Gonna hold 30 seconds. You can try that way. And then you can almost try those windshield wipers just sitting in the golf cart as well too. Just try to get some mobility in those hips. So to decrease the lower back pain you get while you golf, what you have to do is you have to increase the mobility through your hips and your lower back, or through your thoracic spine. So if you accomplish that, your lower back pain will go away. You'll probably increase some distance on your drive, which who doesn't want that? So thanks for watching. If you have any other videos you'd like to see, anything about golf or anything PT related, just leave a comment below. Don't forget to subscribe and give me a like. Thanks.